with the Ocubliss, hypochlorous acid, and the Blefadex. We also express and get out constipated glandular material using Ilux, but we have to maintain that opening. We do that by using heated mask. The heated mask not only softens the glandular material, but it brings in blood flow. Blood flow is the nutrient supply to maintain good, healthy glands so the glands don't die off in time. And remember this, guys, you have to tell the patient this. Our treatment is to keep you from getting worse and perhaps make things better, and to get and definitely to give you symptomatic relief. But we've got to make sure you don't have lid glands that are dying off from not having this treatment. That's the problem. So you hear me say a lot of times to the patient, do you feel like you have a dry eye? They say no. Well, when you do have a dry eye, be sure and let me know very quickly, because we don't want the glands to die off. And what I realize is when patients don't have symptoms, they don't want therapy. They don't see it. But I know it happens. So I plant the seed. As soon as you start to have symptoms, we need to treat this before you start to have the glands die off. They need to understand the need and the recognition on their part for as soon as they start to have symptoms, we need to treat them. They need to know that.
It's kind of backwards thinking.
It is, but it's very hard. It's very hard. Hang on. It's very hard to get them to go through treatment whenever they're not having symptoms. I'm not being bothered. I'm okay. Yes.
But you told me, you explained before, like you wouldn't wait to have a heart attack until you start treating yourself. Is that what they're still kind of like on the edge?
That's a very good analogy. So maybe I can refine my approach a little bit. Maybe I can say, you have ocular surface disease now. It needs to be treated. You could be reluctant to treat it because you don't have symptoms. But keep in mind, we don't have symptoms about congestion of our arteries and veins until we have that heart attack. You don't wait until you have the heart attack to do something about it.
Dental analogy is good too.
Okay. What do you think? Do you have any comments?
It just seems a little scary.
It's a little over the top.
That's why I thought dental analogy, because cavity.
Okay. So that's why I've not been bringing it up. I like your idea, but I haven't been bringing it up because I don't want to be overly pushy, but I still want to get my point across. So how would you make the dental analogy?
So you don't wait to start brushing your teeth, and when you.
Yes. So Mrs. Smith, keep in mind you don't wait for cavities to start brushing your teeth. You do it preventatively, in the same way we need to do preventatively to keep the lids clean.
And you go to the dentist for your teeth cleaning,
Yes.
and the x-rays to make sure everything stays healthy.
Yes. I wonder if we should even have some kind of handout that we give every patient about lid hygiene in dry eye.
I thought we did.
That is our dry. Oh, it's not specific to lid hygiene.
Yes, I'm thinking lid hygiene and the relationship of lid hygiene and dry eye.